You feel a burning sensation rising in your chest after eating. Or maybe you don't feel burning at all. Maybe it's more like a lump in your throat, a sticky feeling, like phlegm that just won't go away. And you keep clearing your throat before you speak. These two things might feel like completely different problems, but in many cases, they come from the exact same cause: a valve that doesn't close properly. My name is Dr. Adrian Cole. I'm a health and wellness educator. And today, I want to explain something that most people never hear from their doctor. Something simple, something mechanical, something that can genuinely change how you feel every single day. Let's start here. The problem is not always too much acid. I want you to really hear that. The real problem, very often, is that your stomach's safety door has been left open. Just a little, not fully closed. And here's the part that surprises most people. You can have reflux and never feel a burning sensation at all. That's right, no burning, just throat clearing, or that sticky phlegm feeling, or a nagging cough in the morning. So what exactly is this door I'm talking about? Think of your stomach like a balloon filled with liquid and gas. At the top of that balloon, there is a small circular muscle. It acts like a knot. It's called the lower esophageal sphincter. Its job is to stay closed so that nothing rises back up into your throat and esophagus. When it works well, you feel nothing. When it weakens or relaxes at the wrong time, the contents of your stomach start rising. And that's when the trouble begins. Now here is a question I hear all the time in my practice. Dr. Cole, should I get rid of my stomach acid? And my answer is always the same. Absolutely not. Acid is not your enemy. Acid kills harmful bacteria. It helps you digest protein. It helps your body absorb vitamin B12. Acid is vital. The problem is not that the acid exists. The problem is that the acid is traveling somewhere it should never be. It's rising up into your esophagus, all the way up into your throat, because the valve, the doorman, has fallen asleep on the job. Now, many people take omeprazole or similar medications for this. And I want to be very clear. These medications are effective. They are necessary when there is damage to the esophagus. They reduce the acid attack and help heal the lining. But here is what they don't do. They do not strengthen the valve. They do not mechanically close that door. So if the valve itself is weak, throat symptoms can continue even when the acid is well controlled. That is exactly why today we are going to talk about how to strengthen that door. Naturally, mechanically, step by step. Let's talk about the first mechanical problem: overeating. Your stomach is a muscle, but it has a limit. Think of it like a water balloon. If you fill it too full, the pressure inside builds up, and that pressure pushes upward against the valve. If the valve is weak, it opens. It's simple physics. Pressure always finds a way out. And here is something important to know. It's not just food that creates this pressure. If drinking a large amount of liquid during meals makes you feel worse, that is exactly why. You are filling that balloon too full. More volume means more pressure on the valve. So what is the solution? There is a very old idea that comes from Okinawa, Japan. It's called hara hachibu. It simply means eat until you are 80% full. Not stuffed, not uncomfortable, just satisfied. Stop eating when you are no longer hungry, not when you feel completely full. That small shift makes a very big difference. Also, if large amounts of liquid during meals trigger your symptoms, try drinking more water between meals instead, not during. Now let's talk about the second mechanical problem. And this one is free. It costs nothing. It's gravity. Your stomach has an interesting shape. It's shaped like the letter J. And here is what that means for you at night. If you sleep on your right side, your stomach actually ends up positioned above your esophagus. Gravity then pushes the contents of your stomach directly against that valve. If the valve is even slightly loose, it opens during the night, and you wake up with phlegm, or a cough, or a burning feeling in your throat. But if you sleep on your left side, your stomach hangs below your esophagus. A natural safety pocket is created. The liquid stays at the bottom. Gas has a much harder time rising. This one simple change, sleeping on your left side, can be one of the most powerful things you do for nighttime reflux. Now, if sleeping on your left side is difficult because of shoulder pain or hip discomfort, there are two other very effective options. First, raise the head of your bed about 6 inches using firm blocks or bed risers placed under the legs of the headboard. Not just an extra pillow under your head, the actual legs of the bed. This keeps gravity working in your favor all night long. Second, don't lie down until at least 2 to 3 hours after dinner. Give your stomach time to empty while you are upright. Gravity is your ally. Use it. Now let's talk about something called chemical sabotage. There are certain foods and substances that don't necessarily cause heartburn directly, but they do something very specific. They relax the tone of that lower valve. They weaken the doormat. And if you want to strengthen that door, it's worth avoiding 4 common things for 2 to 3 weeks to see how your body responds. The first is mint. I know mint tea after dinner feels soothing, but mint can relax the sphincter. If you have active reflux symptoms, avoid mint infusions after meals for now. The second is chocolate. I'm sorry to say this. Chocolate contains a compound called theobromine along with fat. This combination can relax the valve. Start by removing it completely, then slowly reintroduce it to find your personal tolerance. The third is alcohol. Even one drink at night can relax muscle tone throughout the body, including that valve. For nighttime reflux especially, it's best to eliminate it. The fourth is smoking. Every cigarette weakens the sphincter. The more you smoke, the worse the valve becomes. This is one area where there is no gray zone. Quitting smoking is one of the most powerful things you can do for reflux. What about coffee and tomatoes? Honestly, it varies from person to person. Some people are sensitive to them, some are not. If your throat already feels raw or irritated, avoid them at first. Then reintroduce them slowly, one at a time, and pay attention to how your body responds. That's how you find your personal limits. Now let me walk you through a simple 3-level repair plan. Level 1 is about diet and body mechanics. Have dinner 3 to 4 hours before going to bed. Your stomach needs time to empty while you are upright with gravity helping it along. Going to bed with a full stomach means pressure builds up and the valve is overwhelmed. Keep dinners light. Less volume means less pressure. Also, if you are carrying extra weight around your midsection, losing even a small amount reduces the pressure on your stomach from the outside. Avoid tight belts or clothing around the waist for the same reason. And try not to bend forward immediately after eating. Bending increases pressure and can trigger symptoms. Level 2 is about external support. If your valve is very weak, perhaps due to a hiatal hernia, diet changes alone may not be enough at first. This is where products like Gaviscon come in. These are called alginates. Unlike baking soda, which neutralizes acid, alginates create a physical raft, a barrier that sits on top of the food in your stomach. This barrier physically reduces reflux. Take them after main meals and before bed. And after taking them, wait a little while before drinking a large amount of water, as this can wash away the barrier. Level 3 is for people whose main symptom is throat clearing, phlegm, or a sore throat in the morning. This is called laryngopharyngeal reflux. In addition to everything we've discussed, gargling with alkaline water or a baking soda rinse can help deactivate a substance called pepsin that has risen into your throat and is continuing to irritate it. I cover that in detail in a separate video. One very important thing: if you are currently taking omeprazole, pantoprazole, or similar medications prescribed by your doctor for esophagitis, ulcers, or Barrett's esophagus, please do not stop taking them on your own. These medications are important. Everything we've discussed today works alongside your medication, not as a replacement. The goal over time, with your doctor's supervision, is to strengthen your digestive system so that eventually the dose can be reduced. But only gradually and only under medical guidance. A common question I hear is this: Dr. Cole, what about apple cider vinegar? For some people with low stomach acid, it can support digestion. That's true. But if you have active heartburn, pain when swallowing, esophagitis, or an ulcer, please don't use it. Putting acid onto an already inflamed or damaged surface will only make things worse. Another question: can reflux actually be cured? If the cause is related to habits, diet, weight, or stress, then fixing the mechanics can restore much of the valve's function. The problem can be significantly improved or resolved. However, if there is a moderate or large hiatal hernia, mechanical management becomes a long-term strategy. Surgery is considered only in cases where symptoms persist despite doing everything right, or when there are serious complications affecting quality of life. That decision depends on many clinical factors, and it's evaluated together with your doctor. And if your throat symptoms don't improve after 2 to 3 weeks of following all of this, then it's important to consider that not every case of throat clearing, runny nose, or chronic cough is caused by reflux. It could be related to postnasal drip, asthma, laryngeal sensitivity, or even certain medications. Some blood pressure medications, including lisinopril and ramipril, can cause a chronic throat-clearing cough as a side effect. If symptoms persist, please see your doctor, an ear, nose, and throat specialist, or an allergist to look for other possible causes. Now, I also need to share something important. There are certain warning signs that mean it's time to stop managing things at home and see a doctor right away. If you are having increasing difficulty swallowing, especially if it's getting worse over time, see a doctor. If you have intense chest pain and you're not sure if it's reflux or a heart problem, seek help immediately. If you are vomiting blood or anything that looks dark like coffee grounds, that needs urgent attention. If you are losing weight without trying, or if blood tests show anemia, or if your stools are very dark and tarry, do not wait. These signs can point to serious conditions including Barrett's esophagus, an esophageal ulcer, a stricture, or in rare cases, cancer. These are not things to manage at home. Get to a doctor as soon as possible. So let me leave you with this. Your stomach is not just a bag. It's a machine, a balloon with variable pressure and a safety valve at the top. When you understand how it works, you can work with it instead of against it. You don't need to do everything perfectly starting tomorrow. Just pick one thing. Tonight, eat dinner 3 hours before bedtime. Sleep on your left side, or raise the head of your bed. One change is enough to start. And that one change may give you the best night's sleep you've had in a long time. If your reflux comes with phlegm, throat clearing, or a cough in the morning, watch the video I've linked here. I explain exactly what pepsin is and how to neutralize it with baking soda. And if you'd like to learn more about hiatal hernias, there's another video linked here as well. Take care of yourself. You deserve to feel comfortable in your own body. I'll see you in the next video.